raising awareness about an issue that really every city faces, but maybe should be talked about more. The Lucas County Opiate Coalition works with community members and local agencies to help fight the opiate epidemic. Tony Dible with the Lucas County Health Department and Opioid Prevention Program Coordinator is joining us this afternoon. And Tony, let's talk about the coalition. Tell me what the organization's structure is. Now, this is under the Health Commissioner environment.
Yeah, so I work for the Health Department, but you know, the Lucas County Opiate Coalition is really the community's coalition, so it may be technically housed by the coalition, but we want it to be for everyone in the community, and it's not closed off. We have many different sectors involved, and that includes community members. The coalition itself really just focuses on raising awareness, particularly around substance use and this opioid and overdose epidemic that we're in, but also hopefully building community action and really being able to just educate folks on the dangers that are out there. So
it's incredible, the overdoses now. I saw that just this last 12 months in this country, over 100,000 Americans died from an overdose. Is that at its all-time worst from you seeing the numbers?
Unfortunately, yes. We see that in Ohio. We've had a few positive trends in Toledo lately, and hopefully that's the good work of the community. But the reality is, you know, if you're between the ages of 18 and 45 in this country, the leading cause of death is an overdose, and particularly fentanyl, which is what we see now. And that's startling. And I think people know that, you know, substance abuse and overdoses is a problem, but I don't think people really grasp that it's touching so many.
And you would think with naloxone being out there, that would maybe take a notch a little bit down. But I mean, the problem is our country's mental health is so bad right now, lingering from the COVID years. I mean, there's no good time to have a pandemic, but the impact on our society, from whether it's schools, just social parameters, it's been terrible.
Absolutely, and I think we saw overdoses on the rise before COVID, but post-COVID, I mean, it just hit this all-time number. I think part of that is people being cut off from much-needed connections and supports in their communities and, you know, in their lives. That's huge, and I think as we look at, you know, struggling with a substance use disorder, sometimes the opposite of addiction is connection to me, and I think people became disconnected. And then on top of that, the drug supply today is just so much different than even 10 years ago. Fentanyl just driving so much.
Yeah, how has fentanyl changed the game? Because I would have thought that you know, other opiates back in the late teens were bad, but that changed the game, didn't it?
Yeah, and you know, people think fentanyl, obviously in hospitals, it's therapeutically given. It's a great drug. It helps reduce pain for people that really need it, but what we're seeing now is synthetic fentanyl, which is being made in labs, and it's being put in the drug supply in many different ways. So often we don't even see heroin so much, like when we do our fatality reviews, that's not really out there anymore. Everything is fentanyl, and what we like to say is, if you're not looking for just opioids, that doesn't mean that you shouldn't be on alert, because fentanyl could be in anything. It's not in everything, but it could be in anything. We're seeing it in fake pressed pills. We're seeing it in cocaine, other party drugs, finding its way in, people thinking maybe it could build someone's high. And that's leading to fatalities because it's so potent that people don't have a tolerance and aren't aware that it could be out there. So.
Well, you're at the health department and you're really in the know with a lot of this. What would you like to tell people to make them aware of the problem and maybe how we can turn the momentum a little bit?
I think, you know, awareness is huge. I think people understanding that naloxone's available for free. You can get that through the health department. There's other entities, but you can order it by mail through the health department's website, and it'll just be mailed to your house. It's a nasal spray. It's easy to use, but also you can walk into the health department during open hours and get naloxone or Narcan, as it's more commonly known, but it's a nasal spray, and we advocate people carry it like an extension of your first aid kit, because you never know where you're going to be and you may need to use it. It's harmless. That's a big tool, and then also just breaking down the stigma around using substances, I think, is a big piece of the puzzle as well.
What can be done to stop it? I guess, I mean, drug use has been around forever, and it will be around forever. Just the nature of us, we like to drink alcohol, and some people get sucked into drugs for a variety of reasons. Yeah. But to find a way to stop that cycle.
I know, it's a great question, and I think, you know, from the Opiate Coalition, from the work I do, that perspective, you're never going to stop people from using substances. We're all human, and we want to escape our pains, and we want to feel better. So the goal isn't to stop people from using substances. It's to educate people on how to use substances if they're going to safely. And that's by understanding what could be out there, understanding how dangerous drugs can be and ways you can combat that, whether that's carrying naloxone or even there's fentanyl test strips now. So if you know you're gonna party on the weekend or something, you can test your drug supply with an easy to use strip, and that at least will help you know, like, is this drug possibly going to kill me? So there's different tools, and then also just building connections for folks to seek treatment. Recovery looks different for everyone, and that's huge. I think what works for one may not work for the other, and Toledo has many, many options for different folks, and I think finding what's the best fit for you and helping find that support from your community and family is huge too for people, because we don't want to see people suffer and lose their life.
This is Tony Dible from the Lucas County Opioid Commission, and thanks for coming in today. Appreciate it.
Yeah, thank you for having me.